Welcome to Oli Health, the AI-first, all-in-one EHR and practice management system built specifically for allied health professionals. Everything your practice does, finally connected in one place. This is where everything you document becomes one connected, intelligent patient record. All right, 3 things that work as one: charting, the lens, and the AI overview. It all lives on the patient record. Let's open a naturopathic demo patient. Click in, and you land on the lens, an at-a-glance picture of the patient. We'll dig into the lens in a bit. Honestly, it's the first thing you see for a reason. But let's start with the AI overview, one tab over. It's a written summary of the whole patient from Oli's AI. It reads back through their signed notes and documents and gathers the highlights for you. So instead of opening every note, you get their whole history at a glance. It's laid out in clear sections: an action plan, a recent visit summary, and an overview. New information come in. Just hit refresh, and Oli rebuilds it from the latest data. It can also keep itself current, auto-refreshing ahead of a patient's upcoming appointments. It runs about 12 hours early, which keeps things ready and your AI usage efficient. And you control what it writes. Over in practice settings, there's an Oli AI tab. Under AI overview, you can keep Oli's default prompt, or write your own, spelling out exactly which sections to generate and how. So the summary comes out shaped around the way your practice actually works. Now let's head back to the patient and see where all of this comes from: the charts. Charting in Oli is genuinely different, and it gets its own deep dive video. But here's the gist. In an empty note, just type a /, and Oli opens a whole menu of building options. Right at the top, your templates, both the practices and your own. Then the clinical blocks, a big library of ready-made pieces, so you're never starting cold. And these same blocks are what quietly power the lens. We'll see that soon. Counseling blocks, common ones like medications and specialty-specific sets. Plus everyday essentials, text, headings, to-dos, checkboxes, and images. You can even drop in uploads, video, audio, images, or any file for the record. So there's real freedom in how you build a note, right down to custom blocks. Let's pick a template and watch what happens. Choose one, and the whole structure drops in, ready to chart into. In seconds, every section it needs is right there, no blank page to stare at. From here, it's yours to complete, and notice it's all made of those clinical blocks. As you fill them in, that data flows straight into the lens. Labs are a perfect example. Drop in a lab block, and instead of typing every value, click Select and fill using AI. Oli reads the lab report and extracts every result for you. Medications work the same. It brings forward this patient's active meds automatically. No retyping, no copy-pasting from old notes. These blocks are the foundation of a note. Type / for the library, or just write freely. You get full rich text formatting, exactly like any other note. Now, as a clinician, you decide which blocks you even see. Pop into your settings to patient notes blocks. Here you pick the blocks that fit your work. For the demo, everything's switched on. Normally, Oli pre-selects them based on your specialty. Counseling, naturopathic, or others, and more on the way. What you see today is just the start of that set. Adjusting is quick. Switch off counseling, for instance. And every counseling block disables at once. No toggling them one by one. clean and instant. Back on the patient, let's prove it took effect. Open a fresh note, type the / again. And the counseling blocks are gone. You're left with diagnosis and the common ones. So you shape the menu around the blocks you actually reach for. And once you've charted into them, that information doesn't just get buried in a note. Here's the payoff. Let's open the overview and meet the lens. This is where every clinical block you filled comes back to life. The lens is your at-a-glance view of the whole patient. And it's personal. Each practitioner can tailor it per patient. Hit Customize Lens, and you can toggle each card on or off. Here, the common cards and the naturopathic ones are all active. There's Diagnosis. Open more for the full list, each flagged active or not. Medications shows the current plan. One click opens the full view. Vitals are right here. Tap in for every reading. And you can even flip them into a table. Then the specialty cards. This is the gut health block. Click through for the stool chart, the IBS scores, and more detail. There are plenty more, so explore them on your own time. There's even a gut plan. Running a 5-hour protocol, you'll see which phase they're in. And every card links back to its source. Click a value, and Oli takes you straight to the note it came from. That's true everywhere. Any date jumps you back to the chart note behind it. Some of the most powerful, an MSQ symptom questionnaire and a full supplement regimen. You see every supplement prescribed, with its history, in one single view. And then lab results, maybe the most powerful card of all. Once Oli's extracted values from the reports, they plot onto a trend chart. Toggle between analytes and readings to compare whatever you need. For the full picture of how this patient has tracked over time, narrow it to just vitamin D, say, and watch that progression on its own. This is clinical blocks and the lens working hand in hand. You chart into the blocks, the data gets structured, and it flows into every lens. And if those blocks live in your template, Oli's AI scribe pre-fills them right inside the note. All that's left is to review and sign off. Once it's signed, everything pulls together into one connected record. And that's a full 360, the lens, or the AI overview. Charting, the lens, the overview, in Oli Health. And it doesn't stop at the chart. Every part of your practice connects to the same record. Welcome to the future of your practice. Welcome to Oli Health.